So to go ahead and get started, we are going to be discussing the guidelines for opening schools this year safely. And as I mentioned, we have several speakers here joining us today. Katie Anthus, Education Commissioner with the Colorado Department of Education. Dr. Brian Early, Medical Epidemiologist with CDPHE. Therese Polinetti, Institutions Unit Manager at CDPHE. Sarah Blumenthal, State School Nurse Consultant with the Colorado Department of Education. Rhonda Hannaford, Associate Commissioner for School Quality and Support at the Colorado Department of Education. Dr. Eric France, Chief Medical Officer at CDPHE. To go ahead and get started with this, I'm going to hand it over to Katie Anthus.
Yes, thank you, everyone. Good afternoon. Thank you for being here. We know that the safe opening of schools is a critically important topic that touches all of our lives. And we all really want to get our students back into schools safely, where they are best supported and active learners. So I do just want to start by acknowledging we know at this time there's a lot of anxiety for our educators, staff, and our families. We hear the stress and all of the different perspectives on this issue. We know educators are anxious about the coronavirus, and we certainly understand and share that concern. And above all, we thank them for their tremendous work over the last 5 months. Of course, we want to get back to school and do so as safely as possible. And that's what this guidance helps us do. With our partners from local health agencies and districts, it provides a set of standards and best practices to know when and how we can get back to school safely, based on the level of virus in each community. It allows for a local approach, since we know that the virus is not prevalent in some areas. And this guidance offers a layered approach to risk reduction. There are multiple strategies in here so that they can be layered and used to decrease risk based on the circumstances in local communities and local school buildings. Not all school buildings, schools, and communities are the same, so educators need multiple strategies that they can interchange and layer to decrease the risk. And of course, along with our local partners, are constantly evaluating the situation. If new data or science comes to light, we will adjust and evolve and give the best guidance possible to keep people safe. We also know this is complicated, but I know we can do it. I trust our local leaders and professionals to make decisions that are right and safe for their communities. Our districts, teachers, and staff are creative, resilient, and they're all working on multiple contingency plans to support students no matter what the situation. I'm really grateful for everyone who's rolled up their sleeves to create this year. And I know we're gonna have to be nimble. We're gonna have to continue to be nimble in the days ahead and make sure that those contingency plans are all available. So at this point, I'll just talk a little bit about the context of the guidance, and then I'll go into these goals. The Colorado Department of Public Health and Environment and my organization, the Colorado Department of Education, have incorporated feedback from a variety of sources to produce this guidance. But we've worked together with scientists, doctors, and others as they work with school districts on their plans and as we put this together. The guidance is organized by the level of COVID-19 incidence and providing specific recommendations for what school operations would look like within the different levels of COVID, phases or incidence level. So those 3 phases are the same phases that our governor uses when he describes where our state is. So you've heard stay at home, safer at home, or protect our neighbors. So those are the 3 phases that we're going to refer to. In this next phase, the governor really wants to rely on local decision-making based on local context and the presence of COVID-19 in the specific communities. So this guidance is really meant to provide local public health agencies guideposts and best practices for those local decisions as they work with districts. CDPHE is the lead on this guidance, and it's based on the latest science and health recommendations by the American Academy of Pediatrics and others. And we've been collaborating with CDPHE to bring to the table feedback from superintendents, educators, and our advisory group. So as you can see on the screen, the goals of this guidance are, if possible, to maximize in-person learning in a safe and healthy way. We know that that's the gold standard for education, and we know that's really important for our students' mental health and well-being, as well as academics. We want to minimize the disruptions to education. We want to ensure equity and educational opportunity. And as I mentioned before, encourage flexibility, adaptation, and innovation as we develop and learn in the approaches to disease control. And lastly, we want to allow for regional approaches based on COVID-19 incidents, but also our schools and buildings and the flexibility they may need to implement this guidance. So at this point, I'm going to turn it over to, I believe, Dr. Early, and he's going to talk us through the scientific background of this guidance.
Yes, thank you, Katie. So I think we move to the next slide here, Maria. So as we think through the scientific background and making decisions about how best to open schools safely in the fall, one of our guideposts is the American Academy of Pediatrics. And I think they phrased in this email very well what the importance of schools are for children. Children learn social and emotional skills. They get healthy meals and exercise in schools, mental health support, and other things that just aren't available with online learning. And also they pointed out that COVID-19 doesn't impact children the same way as it does adults. There's a truism in pediatrics that children are not just tiny adults. They respond to diseases differently in all sorts of ways. In the case of COVID-19, especially for children under age 10, kids tend to get infected less, they have less extreme symptoms, and are less likely to transmit the virus to others. So we try to bear all this in mind as we go through the evidence that supports our guidance. We can have the next slide. We also look for evidence wherever we can get it, and sometimes that means looking at other countries and how their different policies have affected COVID rates in students and teachers. I think many of you are familiar with the story of Sweden, who kept bars, restaurants, and primary schools open as COVID case counts rose. In general, this has not been a successful experiment. Sweden's cases are 7 times what we're using Finland as a comparator here. So Sweden has a much higher case count. But one interesting thing is they kept primary schools open, which is 5 to 15-year-olds in Sweden. And in fact, the rates of infection in school-age children were lower in Sweden than they were in Finland. Now, I don't think that this necessarily means that the primary schools prevented infection, but I think we can draw information from this to say that keeping primary schools open didn't place their children at a higher risk of infection. Again, these are relatively similar countries, similar health outcomes, similar levels of urbanity, but very different COVID policies. So a great place to learn from. Also important for our educators is that teacher infection rates were similar, in fact, couldn't be statistically distinguished. So again, I think this is an important example for us to look at as we consider our school opening guidance in Colorado. And go to the next slide. We obviously haven't opened schools in Colorado, so we don't have data on what those effects will be, but we do have a lot of information about rates of cases and deaths among different age groups in Colorado. This is data that's available on our CDPHE website, reformatted slightly. But if you look at 0 to 9 and the 10 to 19 age groups, the same age groups we looked at previously, you can see that the case counts are much lower than the share of population, which means, as the American Academy of Pediatrics pointed out, that these age groups are infected at a lower rate than you'd expect for their share of population. And zooming in, you can see that the rates of serious outcomes, including deaths, are lower as well. We'll get the next slide. And so all this information tells us that there's a, informs our way of approaching school opening guidance for in-person education. And And also, we have lessons from our work in other sectors, whether it's congregate living situations, whether it's camps. And we know that interventions work best when they're applied together. No single intervention, whether it's masks or distancing or ventilation or anything else, will maximize the level of safety in an environment. But as you layer them together, you create more and more safety for the people participating in an activity. The interventions we think about for school are encouraging sick people to stay home and providing mechanisms to help them stay home. Create environments that block viral transmission, reduce the number of people who are exposed so that in the event that someone who is infectious walks into a school, they infect the smallest number of people possible. Want to respond quickly to new cases. And as always, this is a new disease and we need to evolve our practices with changing science. I'll get the next one. So as far as encouraging people who are feeling sick to stay home, we know that about 55% of people who are infected with COVID will have symptoms. This may be different for children, but screening is effective for helping people to take note of their symptoms and stay home and get tested if they're feeling ill. It also keeps other diseases out of school too that are important. Flu, RSV, and norovirus are present in our schools and disrupt learning environments, even more so in the midst of an outbreak where we need to respond vigorously to any new diseases that are detected. So screening will probably look like something involving both a temperature check and symptom check, but there's also evolving science around this. Taste and smell seems to be an excellent way to detect infection in younger populations. This data on the left is from the aircraft carrier where there's a large burden of infections, and found that taste and smell was effective in predicting who was infected and who was not. So again, we continue to evolve our guidance as we learn more. I'll get the next slide. Physical distancing, especially 6-foot physical distancing, is an important disease control mechanism, but there's nothing magic that happens between 5 and 7 feet. More distancing is better. It prevents disease transmission. But even some distancing at 3 feet, 4.5 feet, provides a level of protection. And because we're talking about layered protection, we don't need each individual layer to be fully optimized, but we want to consider them holistically and as a package of protection. Spacing also doesn't work as well if people are projecting droplets further, which brings me to my next example. Can I get the next slide here? Is that the population that we're talking about in activity matters. This is data from a choir practice in Washington, which had about 50% attendance and a lot of empty chairs. It was an older group. The average age was 69, so certainly not our typical school age population, but they were singing for about 2.5 hours. And that led to what we call a super spreading event, where very many people were infected by a single infected individual, 87% in this case. So as we're thinking about activities in school, we don't just think about spacing, and we don't just think about screening. We also want to make sure that we're creating an environment where there isn't this widespread projection of respiratory droplets, avoiding activities that do that, wearing things like masks that'll reduce the projection of those droplets, and considering our population too. We have the next slide. Ventilation is something that's also important, and we do encourage schools to maximize ventilation. Outdoor exchange or holding classes outdoors is likely to improve ventilation and and lower the risk of viral transmission in a classroom, and making sure that HVAC systems are well serviced. This diagram is from a restaurant outbreak in China, and you can see that because of the ventilation in this room, many people in tables A, B, and C were infected by that single case A1. But even people in table E who were within 6 feet of the person spreading the virus A1 were not infected. And this is largely due, we believe, to ventilation concerns. So this is another layer of protection, making sure that the airflow in schools and filtration is protecting our students and teachers from disease. And next slide here is discuss a little bit about face coverings. Medical grade N95 and similar masks provide 80 to 100% filtration. Cost face coverings probably provide something less, but they do provide another layer of protection, decreasing that the projection of those respiratory droplets. But we also want to make sure to note that they're only appropriate for people who can wear them effectively and safely. So young children should be supervised. They should be wearing these face coverings during naps, or if they're not able to remove the mask on their own. Again, making sure that our interventions are consistent with protecting the whole safety of our students and educators. And the last thing I want to talk about, which I'd like to spend a little bit more time on, is cohorting. I get the next slide. And cohorting goes by a couple different names. Might see referred to just as keeping people in the same classroom or bubbles, but I think in all circumstances, we're talking about the same sorts of things. Essentially, we want to reduce the number of contacts that each individual has, so lowering the disease risk for the population as a whole. And also allowing us, in the case that there is a positive case in a school or other environment, allowing us to focus our public health response and minimize the disruptions in school. So comparing the two diagrams on the right, the left diagram where there's a single case in a school that has divided itself into 4 cohorts. Only the cohort that contains the case with those students require quarantine or testing or other elements of the public health response. And the rest of the school can continue with minimal disruption. If, on the other hand, a school is not practicing cohorting, as on the right, a single case could lead to disruption of the entire school environment, not just because of the number of people that student might have interacted with in that case, but because it'll take some time to sort out who they interacted with, and that may lead to several days of full school closures, even if it's found that a large majority of the school population wasn't interacting with the student or the case who became ill. So in our guidance throughout, no matter what phase of transmission the state is in, no matter what age group you're talking about, cohorting is an essential component of our guidance. And to provide more information about that guidance, I think I'll hand it off to Therese right now.
Thank you, Brian. We are going to have the much long-awaited guidance posted later today at the link provided on this slide. It will be a comprehensive guide, and we'll talk about each of the sections next. Go ahead, next slide. So I wanted to talk a little bit about the process that we went through to develop this guideline. There really was a great collaboration between the Department of Education as well as the Department of Public Health and Environment. We had educational experts as well as health experts, and we did implore a bunch of stakeholders and feedback sessions with our local public health directors, superintendents, and advisory groups. We started off by working with framework that was developed by the CDC. And we also considered other guidance that was available, including guidance that was put forth by the Denver Metro Partnership for Health, El Paso County Health or Public Health, as well as Oregon and other states. I'm going to start off by talking a little bit about physical distancing, and just to give you kind of a little bit of an overview, since you probably haven't seen the guidance just yet, is it's broken down into 2 separate sections. And one is kind of overarching guidelines that apply regardless of age and regardless of phase. And so that's what I'm going to talk about now. And in all phases and for all age groups, we do want to have physical distancing in place. And it is most important because of the age delineation that we've seen with the transmission and severe effects of COVID with older people and people over the age of 10, that middle and high schoolers are, and adult staff are really where we're wanting to use physical distancing. And as Brian mentioned, the 6-foot distancing is preferred, but we realize that that's not always possible. So we do feel that 6-foot distancing is acceptable, especially when we have a context of comprehensive strategies for layering different transmission controls. And again, that emphasis is greatest for older adults or staff and older children. We do talk a little bit about class size and cohorting, but it really does vary by phase and age. And then we wanted to make sure that special service providers that some kids do need in order to engage and learn are not included in the class size or ratio. So we don't want to limit that at all. Next slide. Healthy environments is definitely something we want to make sure in place for schools to keep everyone safe. There is a little bit about physical barriers and how to do that. And really, thinking through what will work for your school building as far as decreasing congestion during passing periods, meal times, recess, using signage and staggering times of passing periods and things like that work best for your school building. We're also asking that if you have the availability of separate entrances, to use those whenever possible, and then stagger arrival times when kids are eating and recess times. There also should be a plan in place for frequent cleaning and disinfecting of high-touch surfaces throughout the day and then at the end of the day. We also want to make sure that we're maximizing ventilation, especially air exchanges, filtration, pulling air away from occupants. And we are working on an internal guidance document from CDPHE about ventilation and how to do it really well. So hopefully that will be out soon. Next slide. Face coverings. There's been a lot of talk about face coverings in schools and throughout Colorado, and we do want to just make sure that every school is following any applicable state and local orders regarding face coverings. We are requiring that all staff wear face coverings while on site, except where they may be medically contraindicated. There is a provision for temporary utilization of some kind of alternative barrier that might be like transparent for special learning needs, including hearing impairment and language learners. We are requiring face coverings for all students 11 and up while on site, except again, where medically contraindicated. We do encourage face coverings for those 10 and younger, but we do not want to see masks used while students are napping or sleeping, and they should be able to remove their own mask, and it would be best if they could put their own mask on as well. Next slide. We do touch on transportation, and the most important things again are distancing and staggering. We do make provisions for groups that are either in the same family, such as siblings, can sit together, but we want to make sure that we are utilizing physical distancing and reduced capacity. Be thinking about more frequent and shorter trips, and even having classroom cohorts sit together whenever possible if they happen to be on that same route. We do encourage mask use when it's safe. If we have little ones riding a bus and they may fall asleep, for example, or they can't be supervised, that might be something to consider as well. There are guidelines that are available for public transportation that have been developed by the Department of Health as well as CDC, and we ask that you are familiar with those and follow those as much as possible. A little bit more about class sizing and cohorting. So we mentioned earlier that remote learning, or we mentioned how important cohorting is. It really is one of the most important tools we have to limit transmission as well as disruption in schools. In the stay-at-home section of the phased guidance, we are looking at remote learning for most cases. There are allowances for small groups to learn in person, especially for special needs kids or kids that might really need that interaction in person to be able to learn and engage. In-person learning can resume. It may resume, it doesn't have to. This is a community decision during Safer at Home and Protect Our Neighbors. And we're looking at kindergarten through 8 having really no limitation on class size except for the number of adults that can move within and out of that cohort. And then for high school ages, we do have a limitation for the total number of people and based on spacing. And we also do limit that, again, the number of adults that can move in and out of that cohort. Cohorting is recommended throughout all the phases and all the ages. It, like I said, is one of the best tools that we have to control transmission and disruption in schools. We do introduce a concept called partner cohorts once we get to protect our neighbors. And that basically is where teachers can kind of share duties and students can move between partner cohorts. So it just sort of alleviates a little bit of that restriction. Next slide. We also really find it important to make sure that we're taking care of persons at special or increased risk for severe illness from COVID-19. There are legal requirements for alternate work assignments. And so that's something very important for teachers and other staff to have those accommodations made if they are somebody that's identified as a person at greater risk. We also want to be sure that we're ensuring that students in this category have opportunities to continue to engage with the school setting. That could be in person or remotely. And we do want to acknowledge that online and hybrid learning is very likely to remain a component of the curriculum for many districts.
All right, well, we do hope that was helpful. At this time, we're going to open it up to questions and answers. So I saw a couple of questions come through the chat, but if you have a question, if you could please use the raise hand function. So to do that, there's a little participants icon at the bottom of your screen. If you click on that, you'll see the raise hand icon. Click on that. That'll let me know you have a question so that I can unmute you so that you can ask it. And even if you put it in the chat, go ahead and raise your hand as well. Thank you. So our first question is from Chris Vanderveen. And then just if you could just say your name and the news outlet that you're with when you say your question, we would very much appreciate that.
Hi, Chris Vanderveen with 9 News. My question is related to testing and how do we figure out our ability or perhaps inability to do rapid testing and more importantly, get rapid testing results back in an environment where we know that's becoming increasingly challenging? How much is that going to be able to play? How much will that play a role in not only reopening schools, but keeping schools open? i.e., if we have students or teachers that are waiting 7 to 10 days for test results, doesn't that make all of this a bit problematic, if not impossible?
Dr. Early, do you want to start answering that question? And then maybe if someone else has anything to add, they can jump in.
Sure. And I think that the question of test availability and test turnaround speed is something that affects Coloradans across contexts. So very happy if Dr. France wants to jump in and discuss this further. But I think that, limiting the scope of a public health response to those who are really closely exposed to someone who has known or suspected COVID is one of the most important ways to keep schools open. That's why cohorting is so important. We do know that if someone comes to school, no matter what the test turnaround time is, and is found to have COVID or has symptoms of COVID, that's going to disrupt people that they've had contact with in that school environment. Now, if your school is able to practice cohorting and employ layered other strategies, that disruption is going to be smaller. Teresa, I believe, worked on a recent outbreak or a pair of outbreaks in childcare settings where in very similar facilities, one which was able to practice cohorting in groups of, I believe it was 11 or 12, and one which wasn't able to. And that both had outbreaks, both had confirmed cases of COVID, but the school that was able to practice cohorting had temporary dismissal of 11 members of their school community, students and staff, and the one that wasn't had, I believe, 70 people who had to be dismissed for at least some period of time for quarantine and testing of their own. So that's, whatever the testing circumstances in Colorado, whether turnaround is instantaneous or turnaround is taking several days, cohorting is going to be the best way for schools and school boards and educators to approach limiting the disruption caused by cases of COVID in schools.
Yes, it's certainly going to be a challenge. I think Dr. Early's answer was complete.
Thank you. The next question will be from Nicole Fierro.
Okay. Hi, it's actually Kim Posey at Box 31. Nicole is signed on. So what if somebody tests positive within the school? What should the protocol be? And is that different from if somebody has symptoms that are similar to those of COVID, but does not have an official diagnosis yet? At what point do the schools take action? How are those differentiated? And what is the protocol? Is it the whole cohort? How do you do that?
Therese, would you like to start with that question?
Sure. I can let you know that we are working on a comprehensive kind of algorithm that helps us determine when a school would either have to close a cohort or close completely. And that is still in a stakeholder process. So there's still incorporation of comments happening as we speak, but we're hopeful that to the best of our ability, we can keep disruption down to at the most a cohort. And then if we're seeing high levels of absenteeism or multiple cohorts that are in an outbreak mode, then that kind of steps it up a level to a possible school closure. And then of course we would be paying close attention to state and local orders that affect school buildings and whether they can remain open for in-person learning.
The next question will be from Eric English.
Hey there, this is actually Liz with Denver 7 News, but I was wondering, Denver Public Schools is going to begin its school year remotely, and are you recommending other districts do the same, or what is your take on that?
I can take that. This is Katie Anthus, Commissioner of Education. We really are trying to allow this guidance to be driven by local environments and what's happening at the local level. And really the authority for making those decisions resides with the local school board and the superintendent. So this guidance is really meant to give them as much information as possible to make those good decisions. But we know that different districts across the state are facing different levels of COVID. And so the decisions might look quite different across our state. But this guidance is meant to provide best practice and recommendations.
The next question will be from E. Meltzer.
This is Erica Meltzer from Chalkbeat. This is similar. This is a question about cohorts. One of the reasons that Denver cited for starting remotely is that when they started trying to actually plan their school day, they actually couldn't create elementary cohorts that were smaller than 60 people, and they couldn't create secondary cohorts that were smaller than 120 people, and that raised concerns from Denver Public Health. And so my question is, when you start to think about what really happens in the school day in terms of special ed services and kids getting pulled out and teachers pushing in and all the and lunch, how realistic is it to have small cohorts? And is there a cohort size that you're recommending districts keep to, whether it's 20 students or 30 students or whatever?
Therese or Dr. Early, do you want to start and then we'll take it from there?
I can start. This is Therese. We aren't really recommending a hard and fast number. It really is dependent on classroom size, even with the older kids that we are putting in distancing requirements to keep those kids and those teachers safe. But I think, some other things that I think might help schools is the CDE toolkit, which has a lot of recommendations for how to best utilize cohorting and things like block scheduling. And I know Dr. Early can speak even more to what that might look like for a school to alleviate that burden, because we know it's a new concept and it's kind of tough to wrap your brains around. But I think there are some really good suggestions and tools. Brian, do you want to talk more about that?
Sure. This is Dr. Brian Early. I think one of the strengths of having a lot of local control for schools is it gives individual districts and schools the ability to look at their circumstance, look at their physical plans, look at their educational needs, and adopt a plan that makes sense for them. When we're thinking about what's feasible as far as cohorting, we do recognize that in many cases, the class schedule as usual, the class schedule of 2019 might not be feasible this year. But through mechanisms like block scheduling, hybrid in-person and remote learning, proctored learning at different levels. So if you have students, say, taking a foreign language course, some are introductory, some are more advanced, they can still be in the same classroom with a proctor present, but receiving instruction at a level that's appropriate to them, or a number of other strategies. Again, I think the CDE toolkit exists to expand on strategies to achieve what is recommended and laid out in this guidance. But I do recognizing that cohorting is going to require a lot of creativity and adjustments on the parts of districts and schools. And we would not be recommending it so strongly if it wasn't such an important mechanism of both controlling disease and minimizing disruption to the school environment.
The next question will be from C. Moore, Fox 21.
Hi there. Yeah, Carly Moore with Fox 21 here in El Paso County, Southern Colorado. Thanks so much for the opportunity to ask questions. I have kind of a specific question to Southern Colorado. There is kind of a petition for Academy District 20, which is in El Paso County. 250 signatures, I guess, from parents and teachers have been gathered so far. Basically, they're kind of calling on what seems like an all remote learning method, I guess. They say they want to return to school and to our students in person when there have been no new cases reported in El Paso County for 14 days. I guess, is that possible? Is that an overreaction? And what do you recommend for them?
Well, this is Katie Anthus. I think that's an example of where there will be, there needs to be a lot of stakeholder engagement and outreach with your local communities to have those discussions. I think we're trying to have a balance between not having a one size fits all for the whole state, because we know different circumstances are different, just even including things like building size or ventilation systems or, the incidence of COVID in your community. So all of those things need to be taken into consideration with your local public health agency and your local district. And we would encourage folks to have those stakeholder conversations and make the best decision based on their local community.
The next question will be from Taylor Summers. Taylor, are you able to unmute?
Sorry, tech problems. This is Taylor Summers for NBC News Radio. Teachers are being asked to bring cloth masks for the year. My question is, will cloth masks be as effective in curbing the transmission of COVID-19 over a prolonged period of time when teachers are spending hours with students in classrooms? And would there be a potential push from the state to get them something more effective like an N95?
Dr. Early, do you want to start with that one?
Sure. I think an important thing to think about when you're considering PPE is that it's really only effective when part of a comprehensive risk reduction strategy. We think about things like engineering controls, creating the physical space that will limit disease transmission, limiting the number of contacts a person has during the day, symptom screening, and all those things complement the masks. I think in the slides I presented earlier, the estimates for effectiveness of the most effective medical grade mask probably still isn't 100%. So no matter what sort of mask you're wearing, you're going to need to consider other aspects of infection control as well. A lot of our physical spacing guidance also focuses on keeping teachers safe and saying that these are people who need to really observe that 6-foot distancing where available, consider ventilation in the space they're in. So I think in answer to your question, yes, and the most effective mask that's available is appropriate, but also only it should be taken as part of a sort of holistic transmission strategy to prevent the transmission of COVID, and not a single intervention applied on its own.
Thank you. All right, so we're coming up sort of closer to the end of time here, so maybe a question or two more. The next question is from Erin Prater.
Hi, this is Erin Prater with the Gazette in Colorado Springs. A couple of questions here. The first is, what are your recommendations, if any, for serving special needs students or also English language learners who need pull-out and push-in services? I know some districts have used this past spring ISPs to serve these students. Is the plan to keep them remote as far as recommendations go? My second question is there any worry that these children, even if they get the disease and they fare well, that they will still serve as vectors and spread it throughout the community? Thank you.
This is Katie. I can take the educational part of that question, and then I can turn it to one of our health professionals for the second part. But I think you're absolutely right, and that's something that we ask our districts to consider in both the CDE toolkit, but also this guidance, which is be really thoughtful and intentional about how we're supporting some of our students that may have additional learning needs or are at risk for a lot of loss of learning because of a remote structure. So what we ask is that if in-person learning has to, decrease, if we can't do a full in-person learning schedule, we would say that it's very important to prioritize students that really rely on that in-person learning, even if you have to have much smaller groups of students, and then still practicing all of the other layers of precautions, which is spacing and all of the other things we've talked about. So that's important. And then the other very important things we have been emphasizing in the guidance is that if either a student or a teacher or a staff member is at risk for complications health-wise, then that should be taken very seriously and provided remote options if possible.
Dr. Early, did you want to? Thank you.
Yes, thanks, Maria. Yeah, I think the second part of the question was, are we worried that even if kids have mild disease and aren't at high risk themselves, that they would act as vectors and give COVID to others in the community? So there's a couple things to consider that. First off, kids, especially kids under 10, don't seem to be as effective in transmitting virus as adults. In fact, seem to be much less effective in transmitting virus than adults. So this is one of the many ways that kids are not just tiny adults, as I mentioned earlier. So the risk of kids acting as vectors is probably lower than a comparable population of adults. The second thing is that right now, kids are not resting comfortably in bubbles in their home, not interacting with anyone. On my street, and I'm sure many streets in Colorado, there are large groups of kids interacting, playing, going amongst different families. And it's a great neighborhood environment, but it's a difficult disease control one. If one of those children becomes sick, it's hard to trace contact, isolate the cohort such as it is, or do any of the other disease control measures that are available to us in schools. And I'd also add that mask wearing is certainly not the rule in my street, and I'm sure many other streets too. So when we're thinking about whether kids acting as vectors for disease transmission, I think we don't compare schools to no transmission. We compare schools to their behaviors throughout the day. And I think in some ways, schools provide a better, more controlled environment for controlling that.
Thank you. All right, this will be the last question for this media availability, and that will be from Elizabeth Hernandez.
Hi, this is Elizabeth Hernandez from the Denver Post. I just wondered if there was any concern about teacher shortages or lack of teachers willing to teach in person. I know I've heard from several teachers unions who are concerned about this and said so many are requesting, to be online and be remote, and kind of how do you prioritize who gets to do that? And is there a concern that there just won't be enough teachers willing to teach in person?
Hi, this is Katie Anthus. I think that is a concern that we have. I think, we're entering this very new territory that we've never had to start school in an environment like this. And so what we're trying to do is build guidance and build best practices that layer a set of risk prevention so that our teachers and our staff and our students can feel safe coming back to school. I know that we won't be able to eliminate all risk, and we're honest about that. And I know that teachers are anxious about that. And so, that is a concern. We hope that with engagement and layered risk protections that we can have a safe environment starting back, and that using this guidance will really add to that. But ultimately, a lot of this comes down to individual decisions, and I know our districts are doing the best they can to provide alternative work arrangements, but as you say, there will be a limit to that just in terms of numbers. So we hope that we can start school safely as possible, and even if it has to be in limited capacity, for in-person learning to keep our teachers safe.
Great. All right, everyone. Well, that brings us to the end of our time today. If we weren't able to get to your question, we are also available by email if you have additional questions, and we'll try to get back to you as soon as we can. And we thank you so much for joining us. We'll share the slides afterwards as well. I hope you have a great afternoon. Thank you.